We have Laura here, and Laura is a doctor in the NHS. So, Laura, do you want to tell us a little bit about your job before coronavirus and how long you've been a doctor and sort of what your role was like before?
Yeah, so I am what the NHS calls a junior doctor. So I've been a doctor for 7 years. Normally, I specialise in anaesthetics and critical care. And usually, my role involves a mixture of anaesthetising patients for planned operations, so putting people to sleep for hernia repairs, gallbladder removals, that kind of thing. Looking after women having babies, so giving epidurals and back injections for cesarean sections. Some emergency surgery, so things like appendicitis and things that are unplanned, and then some critical care that's delivered outside of intensive care. So somebody very sick in A&E or sick on the wards, they would give me a shout and I would go up and review them.
And so, what effect has coronavirus had on your role now?
I guess the biggest thing and the first thing that really happened was that we stopped doing any planned surgery. And we also moved over to doing only minimal emergency surgery. So unless your condition is life or limb threatening, so it's going to kill you or you're going to lose a limb from it, we're not going to operate. The other difference that started pretty early was I was doing much more critical care outreach work, so much more going onto the wards, seeing sick patients and giving advice or doing interventions. So interventions that I might commonly do would be to put various lines in, so put tubes into blood vessels so that we can measure stuff basically. And that allows us to keep a closer eye on a patient. So I was doing much more of that. And also inducing a coma in patients who are really sick and putting a breathing tube down and putting them on a ventilator and bringing them to intensive care. So I was doing much more of that.
And at this stage, this is people who are just sick in general, like not necessarily COVID-19 patients.
No, this is pretty much COVID-19 patients. So to give you a bit of an idea, at the hospital I work in an average 24-hour period, you would expect between 20 and 30 admissions. And the last couple of 24 hours we've had 30 admissions, of which maybe one isn't coronavirus and all the others would be coronavirus. And the other big difference, and the one that probably the public are more interested in, is we're making more difficult decisions. So previously, as a critical care doctor, it would be quite normal for us to decide whether coming to intensive care is appropriate for a person or not, because intensive care isn't magic. I wish it was, but there are some patients who it doesn't matter what you do, you're never going to be able to make them better, and it's therefore not appropriate to use our critical care resources for patients that don't have a realistic hope of recovery. And that's always been the case. That's not a new thing, but we're making those decisions in much greater numbers. And the truth that's really hard to say and really hard for me to say is that our criteria are much stricter. And if they don't come to intensive care, then the medical team and the critical care team will make a decision about what we call a ceiling of care. So it will be, we would give them fluids, antibiotics, painkillers, oxygen, but we wouldn't put them on a ventilator. And if that's not enough to make them better, then unfortunately that's not enough to make them better. And then we would try and make them as comfortable and dignified as we can, and make sure that they're not in pain or distressed. And that would be we would move to an end of life care plan.
Wow. Okay. You're in a dedicated NHS COVID centre. And so the patients that you have then, what sort of ages are they, and what does that look like?
So I think the thing that's been most shocking for me and my colleagues is that all of the data and the headlines coming out of the rest of Europe have focused on, oh, it's really older people that get really sick with lots of medical problems beforehand. And that isn't the picture that we're seeing at all. if I think quickly around the beds that we had in ITU when I left yesterday, they are patients in their 30s, 40s, 50s, 60s. I would say 50% of them have what I would class as a minor medical condition, so well-controlled type 2 diabetes or high blood pressure, and 50% didn't have any medical problems before this.
Wow. Have you got any specific like stories and things that have come out from working in this COVID centre?
The patient story I'd like to tell is a chap that I saw yesterday. He's 51 years old. He has no medical problems, takes no regular medications. He does not smoke. He is not overweight. 2 weeks ago, he was completely fit and well, working full time. He's got 2 kids and he was playing football in the park with his children. When I saw him yesterday, he had been unwell for 8 days with fever, cough, and breathlessness. He was on what we call non-invasive ventilation, so he had a tight-fitting face mask around his whole face, like those kind of scuba diving masks that you see, and that was attached to a machine that's basically forcing oxygen under pressure into his lungs because he can't breathe sufficiently on his own. And he was so breathless that he could only speak to me in single words. Looking at his observations, he was undoubtedly one of the sickest patients I've ever seen in my career. His oxygen levels were incredibly low. The fact that he was even conscious was a surprise to me. I explained to him through this mask, which makes a huge amount of noise, he can't really see me. I can't really hear him. And I am also dressed in full PPE. So I have 2 plastic gowns, 2 pairs of gloves, a face mask, a pair of goggles, a hat, and a hood. So I don't really look like a person. I explained to him that he would need to be put into an induced coma, have a breathing tube placed in the back of his throat, and be connected to a ventilator. And he asked, please, can I see my wife before I go? And I had to tell him that he couldn't see his wife because no visitors are allowed because of infection control. And he couldn't speak to his wife because if we take the mask off, he'll die. And we also didn't have time to wait. Even if his wife could have visited, there was not enough time to wait for his wife to see him. So I had to take him down to theatre without him being able to say goodbye to his wife. And he said to me, I'm scared, please don't let me die. And I lied to him. I said, I promise I won't let you die. And I know that I can't promise that. But I didn't feel like it would help him at that time to hear that I couldn't promise that.
That's an amazing story, and that has really brought it home to me. Do you have a sort of result from that, or you don't know yet?
So when I left, he was on a ventilator. He was round in our intensive care unit with our intensive care nurses, who are amazing, and things were looking better than they did before he went on the ventilator, but they're still, it's very early. We need to see the average time on a ventilator we're seeing is about 7 to 14 days. So there's quite a while to go before we'll know whether he's going to get better or not.
Yeah. You said you have like a staff story potentially as well.
I work a lot with a doctor who is from Iraq, and she worked on the front line during the Iraq war. And she said to me on our 3rd or 4th night shift after the heat really started to turn up, that she's been bombed and she's been shot at, and she's never been as scared as she is now, because this is a silent enemy. You can't see it, you can't hear it, you don't know it's coming, you don't know where it is, and you don't really know the best way to keep yourself and your patients safe.
It's amazing. I mean, I mentioned to you before we did this, like, I just feel that there is not any coverage of what's going on in the hospital, which is partly why I wanted to do this, because I feel like for someone like me who works in marketing and I can just carry on working from home, all I sort of get is like lots of great fun memes and TikTok videos and lots of people saying that they're going crazy and stir crazy from being in the home. And that's kind of, I'm bombarded with this lightheartedness about the whole thing. And I really don't get to see any insight in terms of what's going on in the hospital. And to hear that someone is saying that they are more scared about the situation in a hospital in London, a local hospital in London, than they are a war zone hospital is just so shocking to me. And I can't believe that I didn't quite realise the level of how horrific it is. So tell us a little bit then about this PPE kit that you've got to wear, which we have heard a little bit about on the news.
So I'm not going to go into what PPE we have and what quality it is and whether we've got enough of it or not. The fact is, if there isn't any to be ordered, it can't be ordered, and we are where we are. But in terms of wearing PPE, we do something called donning, which is putting it on, and doffing, taking it off. And each process takes a good 10 minutes. So donning is less important because you're clean, so you can't contaminate yourself putting on clean kit. And what I put on when I don is a surgical gown, which has long sleeves and does up back to front, followed by a long sleeve plastic gown, 2 pairs of gloves, a face mask, a pair of goggles, which pretty much look like skiing goggles, a hat, then a hood which covers the majority of my neck as much as I can, and then a plastic visor which goes around the top of my head and then comes in front of my face. And once you're in, you're in. So you can't be like, oh, I wish I'd had a wee, and pop out and just take it off and go for a wee and a snack and come back. Because one, you waste a whole nother set of PPE getting undressed and dressed again, and we don't know how long it's going to last. And 2, it takes 10 minutes to take it off and another 10 minutes to put it back on. So you probably can't leave your patient for that long. Wearing it, it's incredibly hot. After about 10 minutes, on the inside of the plastic gown, there's a layer of condensation. So the inside of the plastic gown is wet because you're hot and sweaty. You have to constantly breathe with your mouth open, otherwise you can't breathe. And so your mouth gets incredibly dry and your throat gets really dry.
And you can't take any water, I guess.
You can't drink any water. Your goggles get extremely uncomfortable. So I did my goggles up a bit too tight the other day, and I was in there for 3 hours, and it was like somebody was squeezing my head. It was more painful than the most painful headache I've ever had. And you can't touch your face at all. So I couldn't just adjust my goggles or pull them off for a few seconds, because if I break the seal, then I risk getting coronavirus in and in my eyes. So once it's on, it's on. If your mask elastic goes across your ears, it really hurts your ears. There's a metal strip in the top of the mask that you have to mold around your nose, and that presses really hard. I know of at least 2 of our nursing colleagues who are being seen by our tissue viability nurse, who looks after pressure sores and bed sores, because they have pressure sores on their noses from wearing their masks.
Wow.
So it's pretty much the worst stuff that you can wear. And sometimes the nurses put it on, and they put it on for 5 or 6 hours at a time. I don't know how they do it. The longest I've managed to do is 4 hours, and I was nearly lost the plot completely and couldn't wait to get it off. So it's really, really unpleasant to wear.
And we're talking here like beginning of April, and we're thinking this is going to go on throughout the summer. So I can only imagine that with the heat coming, it's just going to get worse.
Yeah, and I wish we had aircon, but we don't. So if I could ask people to do one thing, it would be, please do stay at home. I know it's boring. I know it's stressful. I know having small children locked up at home, not going to school, not going out, is driving parents crazy. I get that. But honestly, your decision today, what you do with your day today, affects if I will be able to offer a ventilator to the next patient in 7 or 10 days' time. Every time you go out, you are subjecting not only yourself and your family to risk, but you're subjecting me, my family, and my colleagues to risk, because the more patients we have to treat, the more risk we're at.
Thank you. That's amazing. I really appreciate that. And I know for myself that I've been guilty of going out on little errands and little trips to get stuff that really isn't vital. And it's just going to like hammer that home for me to just be more disciplined and just stay in.